This is Adam Lissy, Caleb Bratchett, and Reagan Hillis, and we are students at TLU in the medical terminology class. And today we will be going over the integumentary system. So first, we're going to go over some anatomy. So we have the epidermis, which is going to be your most superficial layer that's going to be like protecting the underlying structures and like help you withstand any like pollution like that's on the outside of the body. And this is the layer that's going to be also shed and renewed throughout life and is made up of five other layers. The dermis is the thicker layer that is connective tissue consisting of collagen and fibroblasts. So you have that like flexibility and that strength, and that's where that goes from in the integumentary system. And it also contains your accessory structures. And you have the hypodermis, which is going to contain your subcutaneous fat, connect the dermis to the muscles, and then that's going to be like your lowest layer of skin. And then you also have the accessory organs, which is going to be your hair, your sweat glands, nails, and sebaceous glands. And then they're also like your earwax or ceruminous glands. And then you have those five layers of the epidermis. So you have the stratum corneum, which is going to be like that top layer. It's going to be mostly made of dead cells that are packed with keratin, which is like a protein that is based for like your hair and your nails. You have the stratum lucidium, which is only found in the palms of your hands and soles of your feet. So that's like that tougher, more thicker type of skin. You also have that's also made up of translucent keratinocytes. And you also have the stratum granulosum, and that is going to be produce a fatty mixture that's going to like make the skin waterproof to not allow like the body to absorb whatever water you put in, and that's also going to cut off nutrients to the other cells, making them die. Like they're not going to be provided nutrients past that point. You have the stratum spinosum, which are just keratinocytes that have nuclei and are attached to each other by spines, hence the name. And then you have the stratum basal, which is a single layer of keratinocytes that contain melanocytes that produce a dark pigment called melanin, and that's just what's going to be your where your skin color comes from. And they also have tactile cells to sense pressure. And then you have a few of these structures have like these specific functions. So you're going to look at protection. So this is going to be your physical barrier, protecting you against injuries, chemicals, the sun with the UV rays, microbes, and other toxins. You also have that water resistance that comes from the stratum granulosum that prevents the water from entering and from you losing water as well. The temperature regulation is going to be a big function because the capillaries going through the dermis is going to help like release heat by dilating the capillaries, and then also the vasoconstriction is going to cause the decrease in blood flow to help you retain heat. You have vitamin D synthesis, which is your skin's going to be able to metabolize vitamin D from the sun. You also have your sensation here, which is because you have the nerve endings that can detect pressure, temperature, and then also like pain. Then you have the glands that'll do excretion and secretion like sweat and sebum and your earwax. And then social functions like it'll reveal your emotions by like blushing if you have pale skin, wrinkled, or any other like social aspects.
Now we have a terminology. We have the integumentary system. That's the body system that covers, protects the body, and consists of skin and glands associated with the skin, hair, and nails. We have the epidermis and the dermis, the two layers of the skin. The subcutaneous layer, a layer of fatty tissue located below the dermis. Melanin, a pigment that gives skin its color. Skin, the largest organ in the body. Sweat glands, a gland that aids the body in getting rid of waste such as salt, and epithelial with the type of tissue that is found primarily in the epidermis. Some word construction and breakdown. We have the epidermis, which epi means above, dermis means skin. So that's the top layer of the skin. We have the hypodermis. The hypo means below. Dermis again means skin. That's the bottom layer of skin. Sub means below. Cutaneous means skin and Os means pertaining to. That's the subcutaneous layer of skin. And dermat means skin. Logist means a specialist, and that's a dermatologist, and that's a medical doctor who specializes in skin.
So some abbreviations, BX stands for biopsy, and a biopsy is something that can be done of a skin lesion using a punch biopsy or an excision of a whole lesion or shaving the lesion for microscopic examination. This is valuable for diagnosing different types of diseases or immune diseases. And PDT stands for photodynamic therapy. This is pretty much a series of sessions that exposes the skin and acne to a high intensity blue light, and that creates a toxic environment which bacteria and the sebaceous glands cannot live. And in addition to treating acne, it has been found to be effective in treating types of skin cancers. And these are the different types of biopsies that can be done on a patient. So a bone marrow biopsy would typically be done with a needle that is inserted into the spongy layer of the bone, which is going to be in the middle, and that is going to be taken out and examined. And this can test for different things like leukemia, anemia, and lymphoma. An endoscopic biopsy is used to reach tissue inside the body, like in places like the bladder, colon, or lung. And an endoscope is a thin little black tube with a little camera and a light on the end of it. As you can see right here, an endoscopy is being done, and then this little image right here is from the camera. A needle biopsy is just used to collect skin samples or any type of tissue that is easily accessible under the skin. You could use different types of syringes, allowing fluid to be drawn out, or fine needle biopsies that can just be punched into the skin. And then a skin biopsy is pretty much, as I was explaining, like just taking some kind of lesion off of the skin. Or a punch biopsy, that's all different types of skin biopsies. And a surgical biopsy is something that should be done if the patient may have an area of concern that cannot effectively be reached using these different types of methods. So a surgeon will have to use maybe like a laparoscope or make a traditional incision into an area. So see, this is an image of a laparoscopy being done. And these are just some different types of needles that can be used for needle biopsies. And this image right here is a punch biopsy. And then just some further information regarding photodynamic therapy. So photosynthesizers are drugs that are administered to a patient, and they remain inactive until they are turned on by specific types of light. And then once they are activated, they become toxic to cancer cells. And so this light activation is pretty much like a waiting period of 24 to 72 hours where the tumor area is exposed to light. And this light source can be a laser or some type of LED. And when the photosensor absorbs the light, this then will kill the cancerous cells. So someone with skin, like a skin tumor, this is just pretty much, the light is pretty much just applied directly on the area, and then a endoscope would be used to treat like places in the throat, airways, and lungs. And how does this all relate to healthcare? Well, these are just some of the different types of health professionals that help patients with doing different types of surgeries or plastic reconstruction to benefit one's appearance, or help after some kind of accident, or just helping with just acne that can be hormonal or pretty severe, just kind of anything that any troubles of the skin that somebody may want to get rid of regarding cancer or anything of that nature.
So how to keep the integumentary system healthy? when we have wearing sunscreen. This prevents sunburn, skin cancer, and prevents the body from aging, more than it needs to. Eating foods containing vitamin A, this is foods like carrots or leafy greens. Exfoliating, that's basically cleaning your face, showers, all that. And then we have proper hygiene.